Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. Doc, on today's show, I want to talk about this problem of degenerative disc disease. And the interesting thing was, in the paper today here in Pittsburgh, there was an article talking about how chronic pain plagues a third of Americans and costs $558 billion a year.
Wow.
So when we hear all this stuff on the news about cutting down on healthcare costs, cutting down on all these, a lot of the so-called solutions out there are really not solutions. Ultimately, the solution to cut down healthcare costs is to get healthy and take care of your own body.
That's what we do, Jerry, okay? Think of your spine like your teeth. You know you can get a false teeth? You can't get a false spine. So if you have a cavity which becomes a bridge, which becomes a root canal, which becomes dentures, that's how they look at the teeth. See, your spine's just like your teeth. So what we want to do, Jerry, is we want to make positive rehabilitative changes in your neck and in your back and your spine so you don't get to the dentures point. You don't get the ankylosing spondylitis where you're in a nursing home, okay? So prevention and maintenance is, to me, what makes sense. So to save the government money, they need to refer these people for chiropractic, physical therapy, nutrition. You can rebuild cartilage and bone with nutrition, okay? Chondroitin, glucosamine, shark cartilage, MSM, hyaluronic acid. They've done studies of the people in Okinawa. They have the highest hyaluronic acid in their diet. There's no arthritis there. There's no degeneration in their spine. They move their bodies. The worst thing to do is to spend a third of your life sitting in a chair downtown Pittsburgh.
Right.
Okay, then you get stiff. Okay?
I think we definitely have gotten lazy. And I think the other thing that I really like to stress to our viewers in regards to this is that you want to start taking care of your body as early as possible.
I would.
Okay, so I mean, if they've got, if you've got kids growing up right now, that whole education of your kids on preventative medicine, proper nutrition, maintenance program, at the chiropractor, looking at the structure and making sure, that you're functioning at that peak level. Because I think too many times in healthcare, people are, we're so used to waiting until we have that problem. Don't even think about prevention. But I really think that, all these things we talk about really comes down to a good preventative program can make a major difference.
You said the key word, it's your structure. We change your structure to improve your function. What a concept. They're not hearing this in the medical community. It's funny you mentioned like the kids. The woman here yesterday, her chiropractor shut down, and so she's going to start coming here. She's got 5 kids, and guess what? They're all under chiropractic. They all get chiropractic once a week. That's 52 times a year. And guess what? They're the healthiest kids, okay? The healthiest kids, Jerry, believe it or not, are the chiropractic kids, the ones that don't get the shots, who get adjusted, who have a good diet, a good lifestyle, okay? I'm pretty sure they're not going to McDonald's, they're not eating fast foods, okay? See, fast food is toxic, and we're going to talk about it in another video, but those toxins are stored in your body, okay? And your body stores it as fat. So if you want to lose weight, you change your diet, your lifestyle, your nutrition. Okay, get the results.
And it's interesting when you talk about her bringing her kids here, because really what you're setting up there is kids that understand this concept. If we're going to make change, you've got to make it in the kids.
You got to. That's where it starts.
Right. We've got to educate them so they can pass that. We've got to break this cycle that I think's been going on for centuries.
See, there's a show on Friday nights. It's called Food Revolution. We're going to start having a show. It's going to be called the Health Revolution. The Health Revolution is you start young and you make positive rehabilitative changes in your diet, your lifestyle, your nutrition, and your structure. And when you do that, you're going to live a long, healthy, wonderful life. You don't need shots. You don't need drugs. You don't need antibiotics. You don't need cortisons. Most of the chiropractic community, the kids I know, they're healthy. They're gymnasts. They're healthy. They're not taking any antibiotics or cortisone. They're not getting immunization shots.
Yeah.
People don't know about it. This is like an alternative society that we have.
Because we definitely start these kids off early on understanding that if I go to the doctor, I'm going to get medication.
Of course, a shot.
They
fear it.
Yeah.
I
mean, everything is right away. Let's give a shot or a medication and.
That's true. Most of the chiropractic kids, they like coming here. It's like they're coming to a spa. They feel good. We have therapy. We put on rollers, intersegmental traction. They have a good time.
Yeah. Yeah, I think people really need to start looking at healthcare in a whole different fashion. I mean, I think we're just so used to waiting for symptoms, waiting for problems, going to a doctor, getting a medication. Where if we start early and we get the adjustments and we look at our nutrition, life is a whole lot, happier.
What would you rather have, Jerry, health care or disease care? When you get drugs and surgery, that's not health care. See, health comes from within. Medical care is basically disease care. It's almost like health scare, okay? So therefore, when you do chiropractic, diet, lifestyle, nutrition, physical therapy, exercise, strengthening your body, you're a strong host, you're not going to get germs. See, Louis Pasteur on his deathbed, he says, germs are nothing. Healthy people don't get sick. First you get sick by your diet, your lifestyle, your nutrition, and your structure. The body's weakened, then you get the germ. Why, Jerry? The germ is the scavenger. So in your kitchen, if you have a healthy kitchen, you're not going to get rats. If you have garbage in your kitchen, you have garbage in your body, you're going to get rats, you're going to get germs. The germs are the rats.
It's an interesting, way. I don't think a lot of our viewers look at their own health care like this because it's been so
Well, they should.
ingrained. And really, I think another thing that we want to stress is it's never too late to start. Okay, so don't feel that you're too far along for it to make a change or benefit you, because it doesn't. You need to start somewhere. Let today be that day.
Do you like quotes, Jerry?
Yeah.
Today is the first day of the rest of your life. Okay.
I can relate to that.
And just because somebody's 72 or 82, they still can be healed. Woman comes in here 93, and she referred her daughter in this week. Okay? So therefore, she's 93, I fixed her up. It doesn't have nothing to do with her age. It's like there's life, there's hope.
Right.
Okay?
And I think if you look at these people, especially an elderly person in their 90s, I know I'm in a golf league on Thursdays, and we've got guys out there who are in their 80s,
God
late
bless them.
80s, and golfing with us,
God
and
bless them.
they're very active. They keep moving. They're, when you get to that point where you just kind of sit there and watch TV and eat that fast food and that bad stuff, that's when you really start to deteriorate. And movement and nutrition, is really the key.
You've heard a lot of stories that somebody's active and healthy all their life, especially men. They retired 65, they're watching TV on the couch for 6 months, they're half dead, and actually in 6 months they are dead.
Yeah. Oh yeah. I mean, the stats are unbelievable when people sit down. You need to stay active. Get up in the morning. Just attack the day.
That's what life
think,
is to me, Jerry. I don't know if
yeah.
you ever heard these quotes. Says life is movement, movement is life. So if somebody's a couch potato, they're actually technically, scientifically half dead.
Yeah. And one of the things, a quote that I always like to use is, there's too many people out there that are trying to survive life instead of enjoy their life.
I've heard that.
Nobody, it can be a great, it's a great world out there, a lot of great things to see and enjoy, but you've got to kind of, first of all, get up and just, put one foot in front of the other, and got to start somewhere.
That reminds me of the movie Wall Street, and Charlie Sheen said to his girlfriend, he said, we'll survive, and she goes, I don't want to just survive.
Right.
I want to live, man.
Yeah.
And then they broke up.
Well, I hope you found this. I know we kind of went off on a little tangent when we were talking about degenerative disc disease, but I think it really comes down to the standpoint of this is just a problem that keeps going on untreated, and get to a point where you're really laid up and you can't replace your spine like you said.
So I make a final comment. See, with chiropractic, you go up, you get better. We're making positive rehabilitative changes in your neck and your back and your spine. In other words, you can't stay the same. It's the law of entropy, Jerry. And basically, to keep it simple, it means you can't stay the same. So if you're here today, you get adjusted, you get better. If you don't get adjusted, you get worse. And the next week, if you don't get adjusted, you get worse. So it's the law of entropy. You can't stay the same. So my philosophy is let's make positive rehabilitative changes in your neck and in your back and your spine so you're better. And once you're better, let's get you 100% better, and let's maintain it. We call it wellness care. Did you ever hear of wellness care, Jerry?
Yeah, and I think it really comes down to just those, like you talked about, if you're not doing something, you're going backward step by step. It's the same thing going forward. It's just one step, just taking little baby steps. We're not saying to anybody that they've got to, make totally drastic changes in 24 hours.
You can't.
Just simple little things that you over time can make a major, major difference.
Think of it like jacking up a car. So if somebody's spine like this and we adjust them, it's closer, closer, closer back, and it's a program of care. We're making positive rehabilitative change. And then once everything's in place, then you maintain it. It's like what you maintain is what you sustain. If you maintain nothing, you sustain nothing. Okay? Whether it's your car, giving a tune-up, a front-end alignment, changing your oil, your body's the incredible machine. I mean, what's more valuable, that nice car you have in the parking lot, or your body? You can get a new Chevy every 3 years.
Right. Yeah, no, I agree. I think we put so much more money into things that aren't as important as our own health and well-being, and that's where we need to
Your
change.
health is your wealth.
Yeah. Well, I hope you really found this to kind of start to trigger a little thought process for you and get you to really think about the true definition of what healthcare should be. Not what you've been used to for many, many years, but now is the time to start thinking differently, taking charge of your own health, being in control. Because ultimately, I think too many times we give up control. We let other people dictate, what is important to us and how we're going to lead our lives. And we need to take that control back. That's what you can do today by picking up the phone, call Dr. Goldberg, stop down here at the office, meet the staff, see the environment, start to appreciate what all this place has to offer. I think you'll be amazed at one, the energy and how people are, if you go to a doctor's office today, very few people are sitting around there and are happy.
Right.
Okay, they're always, you got the sick room, and you got the, when you got kids, you know what I'm talking about. You got the sick room, the healthy room, all this kind of stuff. Here you've got such positive energy, people going in the same direction. And it makes a major, major difference. So we encourage you to pick up the phone and give Dr. Goldberg a call. And one of the things I always stress is that down here at Wellness Associates, they offer a free new patient evaluation. You cannot lose with this situation. Come down, meet Dr. Goldberg, and let him explain what he can do for you. Take a look at where you're at right now. What's your baseline? What can he do to improve it? And if you'll just start taking those baby steps, I think it'll be amazed at what can happen and how much better you're going to feel, and you can start living life again. So with that, we really appreciate Dr. Goldberg spending some time with us today and sharing his knowledge on this field. And we just really look forward to having all of you down here at the practice and starting to take those steps to take control of your health. So thank you very much for watching. We look forward to seeing you on future videos. Be sure to check back regularly at AskDrGoldberg.com. We've got a lot of great shows coming up and a lot of things that I think can really impact your health. So thank you very much for watching. See you at the next show.